So let's see what is the problems or what's the comorbidities of obesity. Let's start by heart and see the coronary artery disease. It's coming from which factors? Actually, obesity and lack of exercise is an important risk factors for coronary artery disease. With that, also we have dyslipidemia, hypertension, nicotine, and diabetes. All these factors, it could give you coronary artery disease, or what we call it coronary artery syndrome. Obesity and overweight increase the risk of, it's not just an coronary artery disease, but also it's increasing risk of hypertension, stroke, diabetes type 2, metabolic syndrome, or what we call it X syndrome, cancer, including endometrial cancer, breast cancer, prostate cancer, colon cancer, and also gallbladder cancer, osteoarthritis, and another problems with obesity, and sleep apnea is also increasing by obesity. If you look to this slide, you will find the relationship between body mass index and the relative risk of comorbidity condition. As I mentioned before in my slide, when the body mass index is increasing, that's mean comorbidity is increasing, that's mean mortality and morbidity is increasing. So look, let's say body mass index here is 30. See here, okay, diabetes is increasing by 8 or 7 folds. If you look to body mass index, let's say it's 22. You see diabetes is roughly, I'll say, 1 to 2-fold, which is with any normal person. If you look to hypertension and coronary artery disease, you'll find it's increasing with high body mass index by 2 to 3 folds. So basically we found there is a strong relationship between body mass index and comorbidities. In this slide, we see the obesity and mortality risk. As I mentioned before, mortality is increasing with body mass index. If you look to this diagram or this graph, you will see that when the patient had a high body mass index, the risk of comorbidity is increasing. It's reaching mortality ratio, it's reaching around 2.5. If you go to, this is a very high risk, if you go to, let's say 35, or let's say 30 or 33, it's a moderate risk. It's increasing by 1.5, the mortality ratio. So again, it's this graph or this diagram is telling us what we mentioned before, is that there is a strong relationship between body mass index, high body mass index, and comorbidity and mortalities.